Thank you for your interest in the Aboriginal Health and Wellbeing major as part of the Bachelor of Science at the University of Western Australia. There's a range of majors offered within the Bachelor of Science, and 5 of these are offered by the Faculty of Medicine, Dentistry and Health Science, including the major in Aboriginal Health and Wellbeing. The major has some complementary units that are required to be taken as a supplement to the core units when the major is taken as a degree-specific major in the Bachelor of Science. Why do we talk about Aboriginal health and wellbeing, and why is there a course that allows you to investigate those areas in greater detail? We are particularly interested in trying to provide students with the opportunity to understand the origins of the health and healthcare disparities that exist between Aboriginal and non-Aboriginal people in Australia. We wish to provide you with an understanding of the historical context in which we find ourselves in Australia in the present time. We will give you the opportunity to explore Aboriginal community initiatives that have been in place for some 40 years that are aimed at trying to initiate significant change in the health experience of Aboriginal people. And particularly, we will be giving you an Aboriginal perspective on these issues. The majority of the staff who you will meet and the people you will come across as you study this major will be Aboriginal people, mostly with a health background, and many will be medical practitioners. What we are trying to get you to be able to do by the time you've completed this course is to understand the ways of working that are most effective when working in Aboriginal health, in partnership with Aboriginal people and Aboriginal communities. We're trying to get you to the point where you can understand about how to, what we call, walk alongside or sit alongside Aboriginal people in the journey towards providing better health and healthcare outcomes. There is a range of things that you can learn, and as we are mainly based in Noongar country on Whadjuk land, we will be giving you the experience of understanding what is going on in the local setting, to understand some of the history, some of the contemporary cultural beliefs and practices and circumstances in this local area. We will also be giving you the opportunity through some complementary units to learn some of the basic sciences that are quite important in future careers related to health and Aboriginal health. The focus that we will give you will be strongly driven by an Indigenous or an Aboriginal understanding. That is why there is a range of units that have that context. If you look at the unit descriptions in the university handbook, you'll start to understand that. As you develop greater skills and knowledge, we are then going to give you the opportunity to work alongside Aboriginal people in an Aboriginal community or organisation with a particular health focus. Of course, we will also talk about some of the complexities in social and emotional well-being that are of relevance in Aboriginal communities and are of great relevance to future workers in health and health-related areas, and we will introduce you to important aspects of research and ethics and get you to do an Aboriginal health-based research project. When you enrol in the Aboriginal Health and Wellbeing major, you can do it as a single major in the Bachelor of Science. You can do it alongside another major in the Bachelor of Science, either as a degree-specific major or a second major, or you can also enrol in it as a major from one of the other degrees, either arts, design or commerce. As you can see, there are 8 core units required for the Aboriginal Health and Wellbeing major, and there are a number of complementary units in both first and second year for students taking the major as their degree-specific major. There are also a number of opportunities to broaden your knowledge base and to have flexibility in choosing other areas of study as your electives and your broadening units. There is a range of career opportunities once you successfully complete your Aboriginal Health and Wellbeing major. Obviously, you can work within the Aboriginal community sector, within the private sector, or within the government. You can also use this major as a beginning point for further study or postgraduate research. So what about the broadening units? If you look at the handbook, you'll see all the options you can choose in terms of broadening units that will complement all of your learning. So, thank you for your interest, and if you wish to get any further information regarding the Aboriginal Health and Wellbeing major, please feel free to contact the faculty advisors or the course coordinator. Thank